I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, there are some obvious downsides to social distancing and isolation caused by the COVID-19 pandemic. But one of the pluses is some extra space, some extra time in your schedule. So what if
That's
you look...
one way to look at it.
So what if you look at the cancellations as an opportunity? Time you could use to make yourself a little healthier.
That is a really zen way of looking at this. We're talking about how to make lemonade out of lemons. And here is one of my great favorite lemonade salespeople to talk us through a few ideas for improving your health while waiting for the all clear is Mayo Clinic family physician, Dr. Elizabeth Cozine.
Thanks for having me. I am looking forward to selling some lemonade. We can do it.
Lemonade out of lemons. I think when people who are listening heard what Dr. Tom Shives said is, let's look at this on the positive side. I think we're all trying to do that.
I think that's about all we can do right now because we're hearing so many scary and unusual and really kind of once in a lifetime sorts of things from the media and from our friends and from our doctors and other healthcare providers. And about all we can do is just try to stay positive.
Yeah, strange times, don't you think? I mean, you and I, and I've lived a lot longer than either one of you, have never seen anything like this.
No, I haven't. And there have been a lot of conversations at my house and friends' houses about this is something our kids are going to remember. I think this is a life-shaping event.
You were saying as we were getting started, you think this is going to change the trajectory of your career. Explain.
Yeah, I really do. You know, I work in an outpatient practice. I see mostly people who are well as opposed to sick people in the hospital, but we're trying to keep them that way. And right now we're being asked to really try not to see them in the office. And so we're doing more video visits, more phone visits. And so the way that we're delivering care is changing much more rapidly than we ever could have anticipated, simply by necessity. And I think that will transform how I do my work moving forward throughout the rest of my career.
Because it's working pretty well, right?
It is functioning, and we are rising to the challenge. We have an awesome team of people.
You can't boil all of your patients down into one anecdote, but overall, how are your patients responding to being under this stress?
Well, you know, I think people are scared and they are not quite sure what to do with all that nervous energy. And so they're reaching out to us and we're trying to help them as best we can. But one of the things that I would kind of advocate for is that there's a lot of really great information on the CDC webpage or the Mayo Clinic webpage, and that's a great source of a first step rather than reaching out to your healthcare provider. If you have some basic questions, those might be some really key, frequently asked questions that you can have on your own and be able to figure out.
Let's talk about we're going to go through a list of a few things you can do to make yourself healthier. But before we do that, let's talk about the mental benefit of being proactive rather than reactive.
Yeah, I think
as
that's
a mom,
huge. Right,
as a physician.
I sure know that when I take care of myself, I'm better able to take care of others. And so it's the proverbial oxygen mask on the airplane. Get that oxygen mask on yourself before you're taking care of everybody else. So for me, what does that mean? That means that I need to keep exercising. I need to make sure that I'm eating food that doesn't make me feel terrible, even though I've grabbed a couple bags of Cheetos here as we've been going through this. But keep those routines that are part of your day-to-day life so you can have as much normalcy as possible during this very abnormal time.
Now, you've got some extra time to do some other things. And tell us, make a list.
Sure.
From most important to maybe not as important, but I bet sleep is on top of the list.
Sleep is huge. And so I think the three things that I would really stress as being opportunities for something new during the social distancing time is getting some exercise, perhaps in a way that you haven't before. Social distancing doesn't mean you have to be inside. Here in Minnesota, the weather's starting to get beautiful again, and you can be outside, 6 feet of distance between you and your friend. Go for a walk, get some fresh air, and that is both uplifting to the body as well as the spirit. And so exercise is really key, focusing on positive sleep. And I've also just started meditating, and I know that's a huge recommendation for people, and people kind of think, well, that's bonkers. Am I going to do that? It actually helps and kind of help with the good sleep and help you turn off that whirling mind. And there are a lot of actually really wonderful app-based programs that are available on the internet or in the App Store and your whatever your smartphone is. YouTube. And one great thing about all this social distancing is so many of these things that were fee for service before are currently free. And so you can try something out with absolutely no financial burden to try to see if it can help you out.
When I saw the sleep was on your list, which of course makes sense, I thought so many people have heard the idea or the suggestion that you go to sleep at the same time every night. Don't set an alarm. Wake up when you wake up. That'll help you figure out how much sleep you as an individual need.
Right.
I'm like, hey, we finally got a great opportunity to figure out how much
this
sleep
is going
we
on
need.
in my house. Like we're watching how we like to be set up. And my husband, who has a job where he can work from home, is now working from home. And so he has now taken to waking up about 7:45.
Never did it before.
No, he wasn't able to do that, but it's kind of the rhythm is nice. So this is an opportunity to sleep in those patterns that you prefer, recognizing that may not be what we can do in the long run, but hey, for now.
At least you'll know how much sleep you need.
So I think there's some pretty good evidence also that exercise can improve your immune system. And how could that be more important than now?
Absolutely.
And then let me ask you, for someone who has never meditated, but you're sort of convincing me that maybe it's a good idea. How do you start? Where do you go?
So I started with an app-based thing, and I thought,
do you want meditation beginner or?
Yeah, I just started with a beginner one, and I kind of realized that as I was trying to fall asleep, it was kind of difficult for me to shut down. And so one of the apps that I use is just kind of says, relax your body, relax your hands, relax your face. And I can feel myself sitting there, and like my cheeks actually kind of fall down, and I think, well, what the heck? Apparently this works. And I'm able to shut down, get ready for sleep. And I actually think the quality of my sleep is improving.
You really don't have to clear your mind of everything.
No.
But what you have to do, at least what is key for me, so that's what works for you. What works for me is to go from seeing my thoughts swirling around in my head to picture myself sitting on a river and watching my thoughts go down the river.
Yeah.
Because then that disassociates you from your thoughts, because right now I am swirling like a cyclone in my thoughts.
I saw a patient yesterday who's had a bunch of life stressors in addition to this pandemic right now. And we talked about, I said, hey, why don't you try meditating? This might be something really great. And this is a person who really enjoys fishing. And he said, well, I actually meditate when I'm fishing. And I believe that, that's a repetitive thing. That's a really kind of Zen experience where you're out in nature enjoying what's around you. And so if there's something like that in your life that isn't necessarily having an app guide you through a meditation, go for it. And those things are not excluded to you at this moment, even though we're asking you to social isolate. So I really don't want you fishing with a buddy, but if you can go out somewhere and do something like fishing or running or walking, that's something that helps you feel like yourself, please do those things.
You could go sit and stare at the water and imagine yourself fishing.
Absolutely.
Maybe we should have a few moments of silence right now. What about from a dietary standpoint? Obviously, a healthy diet is important. I'm thinking specifically, I saw someone recommend you ought to have some plain yogurt every day. Is there any science to that?
I think if plain yogurt is something that you enjoy, you should have it every day. I think that something kind of cool about social distancing is we are being forced to eat at home and cook. And we certainly know that home cooked, home prepared meals tend to be more healthy than restaurant meals or processed things. And so that's a great opportunity. My kids right now are doing homeschool, and they made a cake the other day for homeschool math. My 9-year-old mixed up the recipe, followed it, had to do fractions. And so we had cake. We've been having a little bit of cake every night. So those things are great. But I do think this opportunity at home might be a nice chance to think about your diet a little bit more. Say, I think I might be ready to make some changes. Some of these changes are being imposed upon me. So what can I do within my grocery budget that might be help me make some changes? Eat more plants, eat less meat.
Yeah, we're definitely, everyone is trying to get their hands on their groceries and what are we doing? And so maybe
or even something simple like
plant-based would be a little bit better.
Like if you're somebody who likes beans, maybe switch from canned beans to whole beans.
Dried beans.
And you could do dried beans. It's dirt cheap. If you've got a pressure cooker or a slow cooker, it's pretty easy to ramp it up. And for about $2, and you've got a lot of beans.
By the time you get that 2 packages of toilet paper in your cart, there's not much room left.
Right.
Well, at least a little bit of lemonade in these difficult times. There are more and more people who are staying home trying to avoid getting sick from the COVID-19 virus. And with that extra time on your hands, there are some things you can do to improve your health. Now's as good a time as any, and meditate.
Meditate. And I think if I could have any parting words, they would be, please do stay home. We are absolutely serious that in this crisis, that is the safest thing that you can do for yourself and for your family, is to stay away from them. There are many wonderful video programs where you can chat with your family and still see them and be social, but don't touch.
Our thanks to Mayo Clinic family physician, Dr. Elizabeth Cozine. Thank you.
Thank you.
Thanks, Dr. Cozine.